Welcome to Your Infinite Health. Are you getting older?
Are you feeling it?
How would you like to do that in reverse?
We're your host,
Dr. Tripp
and Lene.
We've run an integrative medicine practice for 13 years.
Together, we have 60 years of combined experience helping clients.
We've helped tens of thousands achieve success in health and live longer, happier lives.
In this show, we'll cover peer-reviewed and evidence-based integrative approaches to creating the health you've always wanted.
We also share professional experience we see in the field every day.
So if you're ready to feel, look, and live your best life, you're in the right place.
Welcome to Your Infinite Health podcast.
Hey, Tripp.
Hey.
I have a joke.
Oh, awesome.
I know, you couldn't wait. How many tickles does it take to make an octopus laugh? That's ever something you wanted to do.
Yeah, I don't know.
10 tentacles. 10 tickles.
Oh, no.
Tentacles.
Oh, no. That's pretty bad.
Yeah, I thought it was really cute. Did you have a good week?
Yeah, I had a great week.
We've done some driving. We put some mileage on the truck and the car here lately, going back and forth to Florida. But last weekend, we dragged the kids against their will and yours. I'm the only one who wanted kids to go. 2 kids and a dog down to Miami. Drove to Miami for the Age Management Medical Group Conference. Mm-hmm. Where you got educated and I got fried. It was not a smart anti-aging decision on my part.
No.
So let's not focus on me. I'm shedding right now too. So let's talk about what'd you learn?
Oh, geez, so much.
I mean, it was only 20 hours of education, 25 hours or something.
Yeah, there was so many things, so many different aspects of what the advances are moving forward, both in the anti-aging or age reversal environment and the regenerative environment. All these things there are numerous things coming up. Despite the recent restrictions of usage of peptides, I think that was one of the things that came up. But other than that, I think the mindset of the entire community, the age management community, is focused on actually achieving really good results with age reversal. And there was some technology out there that some initial clinical trial work had been done on that showed just some phenomenal results. And
on this technology?
Well, by using the technology and with elimination of toxins and that. And one of the things that was really interesting about one of the technologies was that, there are a lot of detox things that are being done, and they're out of about 144,000 toxins that man has put into the environment. We try to do detoxes, but they're only very peripheral results, and the vast majority of the toxins already have an intracellular effect.
Telling me colon cleanses are a waste of time and money?
I'm not going to say that.
Okay.
But the true detoxification is not achieved, and this new technology has actually been shown to actually reverse and detox and achieve detox. So that's one of the things I'll be looking more into detail about talking about, I think, in the near future. So not to spoil that, I mean,
it's a teaser. You have to stay tuned, listener.
Stay tuned.
Look for that episode.
We'll be looking at the means of applying that here in our practice too. So really excited about that. I think there's more information that has come out about, the microbiome, and I think Dr. Sabina Zahn on the West Coast did just an extraordinary presentation on some of the neurodegenerative diseases and causality and relationship with certain factors in the microbiome in the gut, and really interesting things related to autism, Alzheimer's, even the COVID virus, relationship between the microbiome, our gut microbiome, and the potential pathogenic effects of the virus, and how we can protect ourselves and that. So a number of those things came out that were really, really interesting, I thought.
So we'll have to do an episode on that.
Okay.
But speaking of gut health and stuff, we have a guest. So I'm going to interrupt you. So, listener, you have to stay tuned because we'll be talking more about the advancements that are coming out in age management. But I want to get to our guest, Dr. Manny Kukreja. I hope I said that right. She's an MD, MPH, IIN. She's an entrepreneur and the founder of Integrative Health and Wellness, Live Age Well, offering full range of consultation and advisory support to help her clients to achieve and optimize functionally healthy lifestyle to support gut health, immune health, healthy aging, and metabolism. She has recently been the director of Integrative Health and Wellness at Resbiotic, dedicated to communicating the science behind their mission in the community and at industry events, participating in online educational series. She also serves as an advisory role for Resbiotics, The Breather, a lifestyle blog covering practical tips and relevant research at the intersection of lung health and microbiome science. Microbiome. Dr. Manny Kukreja earned her graduate degree in medicine, followed by a master's degree in public health with a major in women's health from Tulane University. She has extensive experience in clinical research in the fields of cancer, heart disease, and chronic diseases with nutritional interventions. She's worked at 3 major academic institutes over the last 13 years. To further enhance her understanding of overall wellness, Manny earned her certifications in nutrition and healthy living from Cornell University, advanced functional nutrition and holistic nutritional health through Institute for Integrative Nutrition. And before pursuing health and wellness consulting, Dr. Manny was involved with clinical trials for cancer and diabetes patients. She noticed rapid deterioration of these patients due to an aggressive nature of different disease processes. And as a longtime believer in functional intervention with a focus on balanced nutrition as an effective alternative to treating chronic disease and controlling progression, she aspires to blend her passion for clinical research with holistic wellness. Thank you so much for joining us, Dr. Manny.
I'm delighted to be here.
So, tell the listener a little bit about yourself, your background, and what got you interested in pursuing integrative and longevity medicine.
So, my name is Dr. Mani, and I am traditionally trained doctor. I'm MD, and I right from the beginning never wanted to practice clinical traditional medicine because many reasons for that, and I'll discuss that with you. I had never actually liked how traditional medicine kind of just bandage approach on the symptoms with the use of pharmaceuticals, because it's just short term or it's just pain. I always had loved to basically eradicate the root cause of the disease, right from the beginning, trying to take care from the prevention approach. That was my focus all the time. So I did my medicine and then I got trained from Tulane University with my degree in Master's Public Health with my major in clinical research and epidemiology. So I could study more the progression of the disease and the prevention. And then I did 14 years of clinical research experience. I was the director of clinical research in chronic diseases. I did 2 years of diabetes research in Tulane, and then 7 years in Medical College, Wisconsin. And then I did in cancers, and then 4 or 5 years in UAB in cardiothoracic health. And by that time, I had almost published many papers, and I very well knew that how the disease progressed and what I had seen in most of the cases in my patients and in subjects. When the disease starts, sometimes the progression is so steep. The decline is so steep, it's hard to control. And if you have your tools with us, your interventional tools, like, how to basically, if you have that knowledge and education and awareness, you can take care of few things right from the beginning so that your quality of life and your outcomes are not that bad. And that's when I thought, okay, I am very well trained with prevention side and medicine side. And then I invested my time and my education in trying to know more functional side of the medicine and the holistic medicine. And I wanted to study definitely nutrition. Then I did my certificates and courses from Cornell University in functional living and integrative nutrition from IIN. And then I launched my practice where I help my clients to basically reset their health and optimize their health from a holistic and functional point of view so they can live up to their full potential. So we take care of skin health, immune health, gut health, hormone health, everything. So it's like a pretty comprehensive coaching for the clients.
Yeah, where is your practice?
It's like a virtual practice. So
Okay.
yeah.
Awesome.
You were in Tulane. So how long were you here in New Orleans?
I was here in Tulane. My husband did his PhD. So we were there for 4 years, four and a half, 5 years. He did his PhD in pharmacology, his MD PhD as well. And I did in Tulane so we were there for 5 years in Tulane. So it was very good experience.
Yeah. Very cool. Very cool. And so I wanted to ask about you're the national director of was it BioRes? Is that what I read?
I did take that position, and now I just recently dropped that position out because I had my business, which had a little conflict of interest, being in the position of the gut microbiome with Resbiotic. So I just quit my position because my other business had a conflict of interest with that. Yeah.
Got it. Got it. Sorry. Old data then.
Yeah. It's my friend's company, so I still help them in when I need to, but not really. I didn't want to keep the position because I mean I'm anyway running 3 businesses. It's hard for me to be taking up one more position with them. It took quite a lot of time of my consumption of time over there in their company.
Sure. So what kind of patients do you love to work with?
Oh, healthy. My clients are almost like they are healthy patients, healthy clients. So I don't even call them patients because they're clients, and these are people who are looking for betterment in their health, people who are a little overweight and they want to be taught and coached about the whole overall functionality of the disease and functionality of the whole overall wellness. So they're all patients who are looking for betterment and for more wellness perspective rather than just being treated with medications, So they would like to know, they would love to be educated so that they can take control of their health from there, because when we treat patients in clinical medicine, traditional medicine, literally see like 35 to 40 patients in a day, working only 10 minutes on a patient. You hardly get to know patients. It's like I don't blame doctors and I don't blame patients, but it's just the whole protocol is infrastructure is that you cannot know. But in my program, any client who's with me day and night, they can text me anytime for any help that they need, clinically related. Plus I coach them enough, I train them enough so that by end of 3 months program, they know what food to eat, what is good for them, rather than taking my probiotic, maybe what kind of food can help them rather than taking melatonin to aid sleeping. What are the different lifestyle that's going to help them in the long run to be having a consistent better sleep? And those are the big foundations that we are talking about, like sleep, nutrition, exercise, protein consumption, enzymes, micronutrients. Those are very essential and critical foundation for patients to better their health.
It's kind of sad that traditional medicine, conventional medicine that we're trained in medical school doesn't really focus on that at all. I mean, we learn the pathology, we learn the diagnostic sequences and the testing and all of those things, and then but we don't get this is how our lifestyles and our decision making, how we choose to make decisions about our health, how they impact us and actually create the disease processes. It's really unfortunate.
Absolutely. It's an extensive program. Medicine is so extensive. I mean, 5 years, 7 years, 10 years of education. But then those basic foundations are still missing, like nutrition and all those lifestyle medicines missing, which I think should be integrated itself in the medical protocol. But now the world is changing. There are so many better advancement. We have those tools that we can go get ourselves certified with, fertility, hormones, advanced stem cell therapy, all those extra educations which are being offered. And I'm happy that that can be extra tool for the doctors to basically add that in their arsenal of education. When this happened personally with me, then I felt the pain of it. That I never knew that I had hypothyroidism. Right after the pregnancy, when I gave birth to my first child, but I never knew it was Hashimoto's because I just had symptoms. And T3, T4, TSH is a normal detection. I mean, normal lab criteria that we do for hypothyroidism or thyroid functioning biopanel, and it was checked and it was consistently low. My TSH was high. Fine. So my doctor said, my endocrinologist, okay, you have hypothyroidism. Okay, so you'll be taking this levothyroxine. So I've been taking that for many, many years, but they never actually, and at that time I didn't know either because I was, quite young in this field. And I thought, okay, so I'm being checked by, and I'm following the specialist who knows much better than me. But he never checked my antibodies. And, my Hashimoto's, my autoimmune factor was missed in the detection. And I went through the whole life and literally for so many years. And then when I got educated in all this stuff that we are talking about, and then I said, okay, now I'm doing extensive checking for myself. I mean, I'm not only looking at my cholesterol, I'm looking at LP little a, I'm looking at ApoB. When I'm doing my thyroid, I'm looking at my TPO antibodies and T3 antibodies. And it seems my antibodies were on fire. They were in storm. I mean, if the titer had to be less than 100, my antibodies were literally 1100, which was crazy, because of which I suffered from gut imbalance, digestive issues, and maybe brain fog. But who knows? We just think it's the part of aging. These are such subtle symptoms. These are such silent symptoms that you just think it goes on with life. Your body starts to decline after the age of 35 and you think it's a part of it. But I had so many food insensitivities. I mean, it was just terrible, but it's not that it was discreet that I could declare it until I came to know through investigation that consistently, when I'm doing my testing every 6 months or every 4 months, my test was constantly just getting worse. The antibodies were just bad. And because of that, I could connect the dots that that's the reason my gut is not functioning right. I have issues of digestive problems, diarrhea, constipations alternate, and bloating and brain fog, because if your gut is right, your whole body functions based on that foundation, right? So my immunity was less, my especially brain fog. And then I was like, okay, I went to one doctor, second doctor, but it was consistent pattern of not being really sensitive to the issues that I'm defining them. So I just started to study more and more about autoimmunity. And the more I knew about it, I could basically take action. I knew, okay, these are the kind of food that I should eat. These are the kind of toxins that I should avoid. This is the amount of sleep and the good quality sleep that I should be following, in my lifestyle practices. And when I could do that, I could bring my autoimmunity into remission. And now it's been into remission for last 7, 8 years. My antibodies are okay. My T3's gotten better. It's almost normal with minimal levothyroxine, with minimal hormonal support, and I'm doing quite well.
Fantastic. Really great. I see the same thing in my practice and getting the lifestyle, the nutrition, adding the exercise, the mindfulness, and all those things. They serve such a huge role in helping us really create what we want instead of just being subjected to all the stuff that's out there, right?
Or making mindless choices.
Yeah, and there's not there historically has not been enough information there or physicians to provide that information, because I guess who was it that said physicians, the job, I think it was William Mayo, that said a physician's job is to prevent illness, but in the face of illness we should prevent the use of medicine and teach our patients to actually create a good health. Of course, he was a surgeon, but
No, I really love that idea of basically teaching your patients to prevent illness. And that's the foundation. If they know it, I mean, imagine they don't have to rush to the doctor, sitting in the doctor's clinic for so long. The life is much easier, and your outcomes are not that bad. Your quality of life is much better.
Right. So are you advising, are you using any of the biological clock testing with your patients?
I use glycanage,
Like
right? So glycanage, because I came to know about it last year in biohacking conference when I went to Orlando, the Dave Asprey's biohacking conference, and I used glycanage. I used it for myself. I mean, I'm not bragging, but my results were. I'm 51 years, and my results were like, it seems like my biological age was 28 to 29 years. So I did an interview with them. They wanted to know what all I do, but nothing different than what all biohackers do, basically. So it was great, and I like glycanage, and I know there are so many others in the market, but they all are good. Yeah, I like glycanage because with this tool, I think you can not only see your biological age, but time to time, you can take some of the measures to follow in your lifestyle, and then you can control. I mean, you can control and you can better it. You can better your biological age depending on all those parameters that they talk about. And they have extensive research. I like to read their papers because their research is extensive. They are constantly going through clinical trials and research, and they publish their papers.
I just met the medical director of Glycanage, and she did a presentation on some of the data that they've been generating on their optimization process, and the results of kind of definitive results for, I thought, for the use of biologically identical hormone replacement therapy for women in particular and men. The results were just fantastic. I think just an average biological age reversal of 15 to 25 years in most patients. So
Yeah.
That's, I think that puts, for me at least, that puts the nail in the coffin of the controversy about whether or not we should be using these optimization processes and the functional processes that optimize our health.
True, very true.
So you have is it out, your book, Live More, Age Less? Is it
Yes.
upcoming or is it out?
It's not yet out. It's, this whole process is, sometimes it takes more than expected time. So my plan is to basically have it launched by around August. So the title might change, it's going to be Living and Aging Biooptimally, or it's all about health optimization from wellness point of view, because I still feel that in between doctors, physicians, and medical knowledge, all the way to the consumer knowledge, there is a huge gap, and when we speak about medical terms, we speak all those medical advancement, and then consumers, the patients, when they consume all that knowledge and those terms, it's not that easy for them. So I'm kind of just in between from wellness and functional lifestyle medicine point of view. I'm writing this book, every secrets, all the measures, all the foundations that can actually bio-optimize your health, so that you can live as well as age in the most perfect manner. So this is what the idea is, so that, usually we know in human life, right, from the age of 35, we start to decline, and that's called midlife. Midlife is a misery, they say, but I want to make this book as a foundation so that you don't call your midlife as a misery, but you rather consider your midlife as your peak, right? So that you can have better energy, more focus, better performance, more clarity, mental clarity, right? Better body compositions. Yeah. All those factors are better and better in that midlife, when actually the idea used to be that, okay, after midlife and around midlife, you'll start to decline. That's not how it should be. So this book is the focus to be doing all that. And it's extensive information. I just do not know how to compile so much and concise it in the form of a book. Yeah, so I'm just, I have the whole manuscript ready, but we are now working on polishing each chapter so it can be concise as well as have enough information for consumers and audience.
You were about to say you were polishing each volume.
It is true. I mean, it is truly each volume, actually, so we just basically need to, yeah, you're right. I mean, we are polishing it so that readers can consume it in the best possible way and they can grasp it and then they can follow those lifestyles and follow all those measures and secrets to the better health.
Well, love it. Look forward to reading that.
Thank you.
So, what is one thing that you would like the listener to know?
I would like my listeners to know, just like I said, aging is inevitable. We all know that. But to be aging in the worst way when you spend last few years of your lifetime in hospitals with doctors and in hospice cares, that is the worst thing. I think lifespan and health span should be very balanced. You age and live to your fullest. That's what I want my listeners to know. And it is definitely possible in the modern world with so much technology, advancement in therapies, advancement in knowledge, AI, and with so much detection, early detection. It is possible to be living all the way to 89 to 90 to 99 and to 100 years, but living to the full youth. Exercise regularly, because exercise is the most important youth elixir. It just reduces your all-cause mortality. It's good for your insulin resistance. It's good for your cardiovascular health, good for immunity, brain health, cognition. And then eat good food, wholesome, organic, diverse food, with no processed food included in your list of eating, and just take supplements, because there are some low-hanging fruits that you can actually just simply take supplements, especially vitamin D, magnesium, omega-3 fatty acids. Very, very important, because these are all those micronutrients which are the foundation for enzymatic activities. And enzymes are so critically foundational and essential to be doing so many functions in our body, like pumping the blood from heart to the periphery, muscle function, for immunity, for neurotransmitters, for hormones, for every single cell function, for cell division, for DNA synthesis and repair, for every single function of cell, you need enzymes. Glutathione transferase, DNA polymerase, most important enzymes. One is important for detoxification. Then DNA polymerase is important for DNA synthesis and DNA repair, so that you don't accumulate all that damaged DNA, because damaged DNA is the source for causing the oncogenic or mutational environment around the tissue. And then you fall, you are at increased susceptibility to be getting the cancers. So just take your micronutrients quite seriously. If you're deficient in vitamin D, magnesium, and omega-3, which literally 70% of us are deficient in those micronutrients because we don't consume them enough and efficiently from our food and from sun. So we need to take supplements of that, and just follow good sleep hygiene. And this is all I can say during this brief time, but take care of your health.
Awesome. Love it. And then where can they find more about you?
So they can find me. I'm very active on my Instagram, on my social media. That is dr_money, MANI.KUKREJA. That is Dr_Mani.Kukreja. And on my website, liveagewell.net. And we have the flow of newsletters that goes out with the blogs and information. So they can follow me on Instagram. They can look through my website, and yeah, I'm quite active there.
Well, thank you so much for that wisdom. Listeners, again, I'll have the links so that you can learn more about Dr. Mani at your leisure. And in the interim, I hope y'all found this educational, informational, maybe somewhat entertaining. And until next time.
Thanks for subscribing to Your Infinite Health. I'm Dr. Tripp.
And I'm Lene. Until next time, feel it, look it, and live it.